Welcome back. I have a new guest with me, and his name is Steve Marmaras, and he is the
Director of Policy and Advocacy for Global Healthy Living Foundation and CreakyJoints.
Say that twice.
Yeah.
Okay.
Yeah, exactly.
Tell me a little bit about what you do first.
Sure. In my role, I manage our grassroots advocacy community of just over 600 patient advocates from the broader 100,000 or so community of Global Healthy Living Foundation. I identify opportunities for advocates to participate in local, state, and federal government to make sure that the perspective of people living with these diseases or caring for someone with these diseases are represented in the policy that local, state, and federal lawmakers or regulators are trying to put forth.
So you've got a pretty busy schedule then.
It is. It's very busy. A lot of our partners, a lot of our peer advocacy organizations are here in attendance at ACR, so this really provides us a great opportunity to catch up with those folks, to make sure that we align on messaging around some of these bigger policy and access issues. And so it's an exciting time. It's a really exciting opportunity for us to all get on the same page before legislative sessions get started in the states, which is as early as January 1st.
Do we have anything that's really coming up that's really important in any particular area right now?
Sure. Yeah, I think there's a lot. There's a lot of really important issues. I think now more than ever, I would say state governments are important. We've been seeing a lot of patient access issues addressed at the state level. So things like step therapy or fail first.
Okay, let's talk about that.
Sure.
Step therapy and fail first, because those are things that I really don't understand or care for. But what do you explain that a little bit?
Yeah, so step therapy is kind of the policy term,
right?
But advocates like to refer to it as fail first because it's a cost containment policy by insurers where they first make a patient step through or fail on a particular drug before they can access a conceivably more expensive therapy that the patient's physician has prescribed them.
And that's in those tiers, right?
Exactly. Yeah.
So if someone's on a tier 1, they got it, and you can't get to a tier 3 unless you've gone through a 1-2.
Exactly. Yep.
And it's just about cost. It's not about whether the patient is going to benefit.
That's right. I think it's important though to say that there are some cases where step therapy is appropriate. Definitely not. We do not believe Global Healthy Living Foundation and a lot of other advocacy groups here do not think it's necessarily appropriate in complex autoimmune diseases, or for instance in the oncology world or space. And so the legislation that we put forth in the states is never a prohibition on step therapy. We don't want to completely eliminate step therapy because there are cases where it is appropriate and it helps to lower cost. But the legislation that we are proposing with other groups really puts in place some streamlines for patients to appeal a step therapy. It brings some uniformity across healthcare plans on the appeals process, and it brings uniformity across the country. So we want to make sure that step therapy procedures are developed via common agreed upon clinical guidelines from professional societies, that there is a transparent and clear appeals process,
right,
and that there are time frame requirements in place for which insurance companies need to get back to the patient and the physician with an answer. Because the laws right now, the laws that we're proposing say they have to get back within 72 hours or 24 hours in the case of an emergency. Before these laws, as a patient, you can appeal a step therapy and you may not hear back for 3 or 4 months.
That's what I'm going through right now.
Okay, I'm sorry.
It's one of those things where it's like, if you could just approve that, that'd be great. If you
Yeah.
could just say, yes, you can go ahead and try that.
Exactly.
Because in the meantime, I'm just experiencing more symptoms
Yep.
and more side effects, negative side effects, things that I just don't want to have to deal with that the medicine could possibly
Yeah.
eliminate. My quality of life will improve.
I'm sorry to hear that you have to go through that. And
It's awful.
I think what our goal is to kind of raise the level of awareness that these step therapy policies and other, they're called utilization management practices, that they may save money in the short term for the insurance company, but in the long term, we think it actually increases the cost of care for the patient and for the system, quite frankly. And so we want to make sure that our policies are focused on the patient experience and not on the payer experience. Yeah.
Good point. Speaking of payer and money,
Yeah.
biosimilars are a very big deal right now.
Nice segue.
Yeah,
I like
man.
that.
I just attended the great debate yesterday.
Yep.
And I thought that Dr. Roy was the most entertaining, and I actually agree with him about the fact that there needs to be more research. So I can agree with the research needs that both of them said, and the fact that we do need to replicate, because isolating just a few studies does not. They don't necessarily translate, because if you go to different countries, we have different diets, we have different, environments, we've got different stressors, it's, lifestyle, family history, homogeneity, all those things are different. So biosimilars, what's your take on, and what does CreakyJoints have to do with the discussion on biosimilars?
Great question. So we've been very, very active on the topic, on the issue, going back about 5 years ago was when we first started getting involved. I think first and foremost, I want to say that GHLF and CreakyJoints, we ultimately put our full faith in the FDA, in the Food and Drug Administration. We trust their process. We trust that if FDA approves a biosimilar to be a mimic of an innovator product, that drug will be safe and effective for our community members.
Got to trust somebody, right?
Exactly. Yeah. I think biosimilars hold incredible promise. They hold promise to expand treatment options because they are mimics of innovator products. They're not exact replicas, but in the way that generic drugs are, but they are mimics, and because of that, it expands treatment options. We need more treatment options in the space of autoimmune diseases, and then ideally they will lower cost. But the key point is, who do they lower cost for, right?
Yes.
And so I think what we're focused on, along with a lot of, I was so glad to hear that point discussed during that great debate, panel yesterday, was that we need to really be hyper vigilant about who the savings are going to and how they are reaping them. So we want to make sure that patients are realizing the benefit of the savings in the form of lower coinsurance, lower copayments, lower deductibles, and lower premiums. And just to be very frank, if biosimilars don't equate to one or all of those things, what's in it for patients?
And then, even more scary is the thought that that a pharmacy might be able to give you a biosimilar without informing you or switching it because it's the generic and they can switch whenever they want to.
Yeah, so I think you touch on a really important point. So there have been efforts underway for the past 5 years at the state level. So this is another example of your state governments playing a really important role, where states are updating Board of Pharmacy Practice Law to amend the language regarding generic drugs and generic substitution. Because right now it's very clear, the letter of the law is very clear in all of these states about how a pharmacist substitutes a generic drug.
Okay.
But remember, I just said that these aren't generic drugs.
They're similar.
So we need to update that language to include biosimilars and interchangeable biosimilars.
Okay.
And so 36 states and Puerto Rico have passed this, essentially these amendments to Board of Pharmacy Practice Law that puts in place a very clear process that a pharmacist follows to substitute a biosimilar for the innovator product in what we think is a very safe and transparent way. So just to name a few of the things it does, it requires the pharmacist to inform the prescribing physician. It requires the pharmacist to inform the patient. It requires the pharmacist to keep a record of the substitution for a certain amount of time. And then it also puts in place the option for the physician to write on the script, "Do not substitute," or "Substitution prohibited." And so that physician then, under the law, has the right to intervene and kind of clearly notate that they don't want a substitution to occur. So we think that this effort, these state laws, the 36 in Puerto Rico, are really critical because, most importantly, it protects the patient and the physician relationship. So we put in place aspects of the law that really protect that relationship, make sure the power is really in the hands of the patient and the physician, rather than a third party like an insurance company or a pharmacy benefit manager.
Very good. Okay, and so I think that we have time for one more question before we wrap this up. You were talking about the patients. Tell me a little bit about patients' access to care.
Sure.
In terms of
So that's a loaded question. I think what I'd like to say about that is that in 2017 and into 2018, we're seeing a time where access to care for patients is really under attack like it never has been before. We are seeing efforts to restrict access or to direct access to certain therapies and really take, in our opinion, tools out of the physician's toolbox based solely on cost.
Is the cost the major thing that's turning all of this upside down?
It's the major driver, and I think it's important for us to also acknowledge that those efforts aren't, they're not. It's not that they are not important. It's very important for us to try and keep costs down. Right. We are supporters of keeping costs down and measures to do that. And just like I said about step therapy, it's not appropriate to always outlaw it because it does help reduce costs. Right. But we need to find a middle ground, and I think that state legislation for step therapy is a great example of finding the middle ground of being cost conscious but also protecting patient access. But just in closing, I would encourage anyone out there who's listening to this to really, if you are not already a part of an advocacy organization, join one. It's more important now than ever to really share your voice as a patient or as a caregiver for someone living with these diseases. It's critical that our legislators, our regulators are hearing from folks that are living this experience, and that our laws, our regulations are written really in response to the actual consumers and the people that are benefiting from these therapies. So you can join our advocacy organization. It's 50 statenetwork.org. We'd love for you to become a member. You don't have to have a certain type of a chronic disease. We're welcoming all. Or we encourage you to join other advocacy organizations at this conference. There are several great ones. We all work very collaboratively together.
Awesome. Thank you, Steve.
Thank you.
So we are going to be taking another break now, and so we'll be back in, like 5 minutes or so. Thank you. Thanks, Steve.
Absolutely.
That was fun.
Thank you. It was great.
Okay.